Welcome back, everyone. This is the first of two lectures on light sensors and mobile health. In particular, we're talking about photoplethysmography, which I can never pronounce, and I always refer to as PPG, like many other researchers and practitioners. But what is this? This is a simple light sensor, and many wearable devices they are now equipped with light sensors. And their main use has been, well, it's changing every day, but essentially it has been to detect heart rate features, but now it's expanding to also respiration. There are other applications of light sensors, in particular, one that my group has worked on. And so I have one slide on that, and it's related to the fact that the sensors don't have to sit facing your body and your skin, as we will see for the light sensor related to health, but mainly they could face outwards and recognize the signal among each other. This is the only slide I have on this project where we put light sensors on tags that people wore on their chest, and the sensors would emit light and then detect each other's light and detect, and then this detection would allow us to indicate if a person was facing each other and at what angle they were facing each other. A possible application of this technology is in training perhaps sales person or training doctors to interact with patients and conveying information, as well as groups, like in this case, studying how people interact with each other and their body position while they do that. So this stuff is all emerging and it's very interesting. But we will mainly concentrate on the use of these sensors in contact with our skins, and I will show you some examples. So PPG consists of a light emitting diode and a photo detector. This is the same, by the way, for the sensors on the chest that we just saw in the last picture. So the PPG sensor will measure the reflected light transmitted either through the tissue or reflected by the tissue. And we'll see a couple of pictures in the next two slides. And by looking at the intensity of the reflected light or transmitted light, it is possible to detect the variation in blood type, oxygenated blood, and count heartbeats, for example. So how does it look like? I'm sure you have seen this in hospitals or even recently due to the COVID pandemic in terms of oxygen saturation. The most traditional PPG would have light on each side of this. This is my beautiful drawing of it. And here is a picture. So there's a light on the top and a detector on the bottom. And so what you would consider for your algorithm is the light that is makes it through this detector. You know how much you're transmitting, and now you also know how much you're receiving through, and you can then make inference about blood things, as we will see. But most of the devices that are now embedded in our life, like such as this watch, have a reflective PPG, and it works slightly differently. And it works this way. So you have the source and the detector of the light on the same side. So it's on the back of the watch in this case. And the detector will detect how much light is reflected by the tissue and the matter here under the source. And so it's about reflected light and not transmitted light like before. The theory, however, is the same. There are some lights that are at different wavelengths to others. I'm digging back for your physics A level. So green color light would have a wavelength of 500 nanometers, while infrared will have a wavelength of 1,000 and above nanometers. And red and infrared are absorbed less by the volume of water present in tissues compared to green light. There's a very ugly picture of our side of the wrist that I've drawn down there. You can see the green light gets only to certain depth of our wrist, while the red light goes a bit further. This allows any algorithm to consider different parts of our body, different parts of our cardiovascular system, and consider both to decide on things related to our health. We'll see some examples. So green light penetrates the tissue less than red light. So PPG is now embedded in many devices. Now we're starting to see headbands, goggles, watches, definitely all watches now. Here are some old examples of watches and straps. Earbuds are also starting to, in research, have this sort of things. But how does this work? We talk about systolic and diastolic in the heart in one of the previous lectures. I have one more slide coming up next. But essentially, the idea is that the light absorption goes up when the heart is pumping the blood through the body. So fresh blood going into the body. So the systolic pushes the blood, and so the light absorption is more, light is absorbed more. And also there is another component, which is the light absorption of oxygenated hemoglobin. So blood is different from that of reduced hemoglobin. So blood that is being just oxygenated by the lungs and pumped out is more oxygenated. So it's absorbing more light. The absorbers also have two components. One is the AC component, alternating current, and direct current component. The AC component is the one that is oscillating, the one on the top here, the one that we will concentrate on because it describes volume blood changes, arterial blood, and so the non-pulsatile component, the one that stays contact, the blue part down there, is attenuation by things that are kind of contact, skin, bones, tissue, and the static blood, so anything that doesn't move. There are slow variations in addition to it, attributed to other things, but this is roughly. So in the end, what for heart pulse, the important bit is the top AC component, isolating that to try to understand. So we talked about systolic and diastolic. So systolic is when the blood is pumped out, so just came from the lungs and is fresh and full of oxygen, is pumped out of the heart and through the body, so the body gets full of blood. And then diastolic is when the heart muscle relaxes and filling the chambers with the new things that will be pumped up next. And this is kind of the relaxing bit. So there is less light absorption in that phase, and we saw it here. One thing that is perhaps counterintuitive here is so this is this line can be seen in two ways. So it's often shown this way. The light absorption. So there's a light absorption graph instead of the opposite. So we use the light absorption graph. So it goes up when there is less light, not more light going through. So how is the heart signal measured with PPG? Well, the signal has two phases. This is the anacrotic phase and is related to the systolic phase that I just described, and it goes up, the absorption goes up. And then before the diastolic phase, there is a little notch, because the dicrotic notch, and then there's the catacrotic phase, which is associated with the diastolic phase. So this is a very good example of a wave, a PPG wave. So the first bit is that the signal doesn't always look like that. Like all the signals, it needs some cleaning. And we've seen it over and over by now. There's a phase of band filtering to isolate the AC component, the one that is oscillating. And you can also have some techniques to cut unacceptable aspects of the signal. In particular, three are used at the pre-processing of PPG quite regularly. One is Shannon entropy, and we've seen it in the previous lecture. The other two are skewedness and kurtosis, which measure the signal symmetry and the deviation from the mean of the signal. And these are quite good in terms of PPG. Skewedness and kurtosis were also mentioned in the lectures of audio, but not as specifically as in this case. This is a quite common measure that is used. So now, once the signal is clean, we can find how do we measure the time between beats, the interval? Well, you would have to find something in each signal that you can refer to, and then measure the difference. So, for example, a systolic peak, we've seen it in this slide. You can say the systolic peak in this wave is at this time. So this is time on the x-axis. And then the next one is there. So you can measure the distance between the two. That would be one way of calculating the time interval of beats, between beats. But there are other ways. We'll see it in a couple of slides. But the signal can be influenced by other things, such as motion. We have a few slides on the end. The quality and fitting of the sensor, so it's not always very precise. And the breathing, which is at a similar wavelength. So it has similar frequencies somehow. So the interbeat interval, which is what we're trying to measure, measures the interval between two consecutive heartbeats. And it's important for applications of pulse rate variability, arrhythmia, and anything that is related to the heart. We saw in the previous slide that I suggested that one way of measuring it would be to calculate the distance between each systolic peak to the next one and see how it changes. But the literature indicates that there are better points, more precise points to calculate this. And one is the pulse onset. So, but systolic and diastolic peaks are also a possibility, and so is the dichrotic notch, the point in between the systolic and diastolic. Start and end. But interval between pulse onset seems to be the robust way of doing it. If you want a bit more, I put a reference at the bottom, but this is our curve again here. And so the pulse onset will be somehow around here in the definition. And the definition of the literature is, I'll tell you how this sort of works, calculate this peak. So this is my very badly drawn PPG signal. We just saw an example of it in the previous slide. And then if you calculate the derivative of it, whenever there is a flex here, so whenever, I'll show you better in this one. So at some point the curve changes. So it's called a change in direction, a flex, and you'll be around here. Obviously, the first derivative will be max there. And so here is my very badly drawn, here's the flex, here's the top, the max here. So if you consider that point, and then you consider drawing a tangent at that point. So this is, again, your PPG signal, not the derivative. So this is it. And we saw here that wherever this is at max, well, here there is your flex point. That's an easy way of doing it. At that time, you have this point, and you draw a tangent here. Then you do a tangent at the minimum point here. And then where these 2 points intersect at the time axis, you draw a line and find the point on the curve at that time level. This is the definition of pulse onset. And that's the one that has been used to calculate interbeat interval. If you don't want to use the systolic peak, or considering that the literature seems to think that this is more robust to noise. And so one application of all this PPG aspects is the detection of atrial fibrillation. Maybe you have seen this in the media, or you have some of the watches. I have an Apple Watch, and they do consider atrial fibrillation warnings. And so here is a set of pictures. There's a reference to a paper later in the slides, where we show the PPG signal with the peaks. You can see the peaks of the signal and the notches and up and down. And here is a case of sinus rhythm, means normal heart rate. Atrial fibrillation, this is a case where the user has an example of atrial fibrillation. Atrial fibrillation is important because it's a case of arrhythmia that is causing a 5-fold risk of stroke. So detecting it in time might allow a bit of help or drugs to work in time before a person gets a stroke. And so this is PPG. This is an equivalent ECG. We haven't talked much about ECG. ECG is generally not very portable. You probably, maybe you are too young for it, but the way in which ECG is used is by, if you go to a doctor, they would put various detectors and wires on your body, and then there's a machine that calculates the ECG, and through passing electricity kind of through your body, then it generates a signal that is able to detect the rhythm of your heart. The portability of it is an issue. I now have a portable ECG on my Apple Watch, but it's a one lead ECG, meaning that it's less precise, doesn't have all the leads, all these wires that you would have in a professional one. And so PPG instead is much more portable, can be attached to various portions of our body, and that's why it could be a good alternative. But here is just a correspondence. So this atrial fibrillation could be detected by ECG and PPG as well. So on the third line, you can see the detection of interbeat intervals through PPG and ECG on both slides. They're quite corresponding, and they're quite different for the two normal and abnormal users. And below is what's called a Poincaré plot. It plots a certain time, interbeat interval at a certain time, and then on the y-axis, the time after. And it shows the variability of it. So by showing where if at time t we're here, at time t+1 we're in a certain place. And if you look first on the healthy individual, you see that this is all in one place somehow. It's quite regular. There's less variability at all. And instead, there's a much greater variability in the arterial fibrillation case. And so classification at that point can be applied to just the Poincaré plot. But there are other features as well. So this is a paper that studied an assessment of can smartwatches identify arterial fibrillation. They have quite a large number of participants, and you see in the fourth bullet. They use PPG over a minute to classify if the pulse was regular or irregular at rest. And the interpeak intervals are plotted as a Poincaré plot like we've seen before. And then 5 or 6 consecutive tachograms, so this kind of detection in a 48-hour picture are collected. And if they are irregular, then the user is notified. So if you do a few of these, and 5 or 6 are regular, I can't quite remember how many they're calculating, but let's say you do this regularly and you have a ratio, if X of them are irregular, then you notify the user. This is a chosen variable, but they also confirm this by ground truth values of ECG. And when the PPG was able to predict the value, then they would say that it had a good predictive value. So with respect to ECG, just considering one individual tachogram, and if one is irregular, had a reasonably good positive predictive value of 0.7. But if you then considered an irregular pulse notification, so one that considered more than one tachogram, so it was based on more data, then the accuracy would go up even further. So the possibility of using PPG for arterial fibrillation is a concrete one and a very good one. So we have seen the use of interbeat interval variation with a Poincaré plot to understand changes in atrial fibrillation and differences between atrial fibrillation patients and healthy individuals. And one measure that is commonly used to refer to with respect to this interbeat interval variation is heart rate variability. Heart rate variability is generally a good thing when high, and has been used for diagnostic monitoring of a cardiovascular disease, autonomic disease, and mental health diseases. In particular, when you're stressed, your heart rate variability usually decreases. So it's a measure of stress, and it can be easily measured as the change in the difference between time difference between adjacent peaks in the PPG signal. So it's the beat-to-beat variation of interval. We have seen that the Poincaré plot that were used in the previous work were calculating a similar measure, interbeat variation between consecutive intervals. And when this was very varied, very high, that was a symptom of atrial fibrillation. There's also this work, which was published this year, in fact, indicating that higher heart rate variability was a predictor of atrial fibrillation patient hypertension. So although a generally high heart rate variability is a good thing, there are values beyond which this is not a good thing anymore. Another measure we have seen when we talked about audio was the respiratory rate. And it's the number of breaths taken in a minute. And it's used in a variety of clinical settings, respiratory diseases, but also even stress and mental health related, as well as cardiovascular, in fact. So again, you would apply filter bands to the signal. In this case, it's just the PPG signal, and you would use features related to the frequency and time domains. In time domains, it's very similar to what we've done for the audio and what was done for the PPG, identifying the peaks and then calculating the number of peaks in a certain interval, perhaps a minute, and that would give you the respiratory rate. You can do it also on frequency by calculating respiratory factor and using the frequency corresponds to the maximum power, and that has the kind of similar effect. Blood pressure also is a value that is very important and measured. There are currently no standard tools, like the watches are still not doing accurate blood pressure monitoring, but many devices are starting to appear that are able to do it. And it's very important, again, for health reasons, and it impacts a variety of other organs, and especially the heart or the brain. If you have high blood pressure, the organs are really under a lot of stress. And the way in which blood pressure could be measured intuitively at the moment is to place PPG signals in two different locations, measure essentially the time it takes for that wave to get through and to travel to one another. And the blood pressure is inversely proportional to the pulse wave travel time. There's physics around it, which I'm not going to explain. Peak time shift is used to measure the travel time in the pulse wave, and you can imagine why, because time at which it's first here, and then you see it going through somewhere else. That would tell you how long it took in between. Arterial stiffness is how the blood vessels wall are stiffening, and therefore they are increasing somehow the blood pressure. The two phenomena are often related, and there is some causality between the two, because the harder are your vessels, the more pressure the heart needs to put in pushing the blood around. And then arteries tend to stiffen with age, and so transmission tends to get faster. So you have to, it's not elastic, and it would not get through as quickly. And it's measured similarly to blood pressure using pulse wave time. I started this lecture by mentioning that you might have seen PPG, traditional PPG, in hospitals when they measure oxygen saturation. And in fact, here is an example. Oxygen saturation can be measured through these devices. Oxygenated hemoglobin, so oxygenated blood, absorbs less red light, while the oxygenated hemoglobin absorbs less infrared light. So the ratio between the two can give away the peripheral saturation, oxygen saturation. So here is a formula down at the bottom, and it also uses the AC and DC components of it if you want more details. But I refer to the same chapter here that has some details about how to put this into practice. But I just want you to get a little idea on how this phenomenon works. Now, in all this, there are things to control for. Motion is one we are talking today, and then in the next lecture we'll talk about other things. Obviously, demographics, but also ethnicity and in terms of skin color, rather, are aspects, and I'll leave it for the next lecture. Location of the sensing also, there's some colleagues of mine define the wrist as the worst place in the body that can be used to detect cardiovascular measures because we move it so much, and then the blood also is in a very peripheral point. So there are consequences of trying to measure from here. We think this is a good place for us to watch, but it's not the best measuring place for our. And in fact, new technologies are coming that try to measure it from other places, like our ear. So one way to get away from problems related to motion is avoid to sample when the accelerometer detects activity. Now, this could be useful if you are interested in heart rate at rest, but it's not very useful if you're trying to understand the fitness of an individual under movement, under sport. And so, yes, I'll talk a little bit about this, but it doesn't solve the whole problem. So, so you can use an accelerometer to filter out the motion artifacts and the motion data, or decide to only detect when the person is not moving. You could try to use a filter to really filter out all these movement things, and use estimates over time. So a study cited below cites an error of 2.15 beats per minute at rest time. So it's a good low error, but this goes up to 7.7 during treadmill activities, which is considerable. 7 beats per minute is a considerable error, and considering also the confidence and the aspects. So we still haven't quite solved the problem, and this is on the wrist, right? There are other things that you might be interested in, and that could be related to, we talked about sampling for the sensors. Because of the battery, we have a watch often, and we have other devices, and that they have a battery. And so you really don't want to oversample if you can sample less. So wearable devices typically sample at a certain rate, and some studies have shown that to understand heart rate, you might be able to sample at 9 hertz. For pulse rate variability, heart rate variability, 25 hertz is needed, and respiratory rate, then you need 16 to 18 hertz. So generally, this is still an area where people are looking at what is best and how to get the best values for this and finding the right features. But these are measures that you can find or read more if you're interested in trying perhaps a project on this stuff. Finally, as I said, yes, we have watches that start to have also some monitors. The latest is the oxygen saturation that we start having on our watches. But there are other devices. For example, there is a ring as well that starts having PPGs, and earables, so things in our ear. People are starting to put PPG in our ear, although again, motion in all these settings might be a big issue. And thank you for listening today. And I will stop here.